Hello viewers. Now we are about to discuss weight gain during pregnancy. This is a very common question asked by many pregnant women. What is the ideal weight gain during pregnancy? Am I gaining enough weight? Is that safe for the baby? Is it too much if I gain a lot of weight? Or if I don't gain weight, is that a big problem? Most of the time we face a question, I'm not gaining enough weight, is that going to affect my baby? So I'm just going to tell you how much is the ideal weight gain during pregnancy. Usually as the baby develops, the weight of the baby and the fluid around the baby counts to some weight gain in pregnancy, but that is not all. There will be lots of changes happening inside the body. There will be increased volume in the pregnant woman that contributes to weight, and each organ, the uterus itself, that carries the pregnancy, that also gains weight. So it's cumulative weight that's responsible for the total weight gain in pregnancy. And it's a misconcept that is running that you have to eat for two, one for mother, one for kid, and that's completely a myth, because you don't really have to eat for two. All you need is 300 extra calories additional to your usual requirement. And these days we are seeing many women who are obese, means they've already put on too much of weight, and for them we don't really advise that you have to eat too much, gain too much weight in pregnancy. For them we will say even if they gain 6 to 7 kilograms, that is almost just the baby and the fluid around the baby and the uterus, that is enough for adequate growth of the baby. You don't really have to do too much of eating. And ideally, if women who is of normal weight range, we will say the average weight gain will be around 10 to 12 kilograms. But that is not a definite measure. It could vary. And especially in the first few months of pregnancy, they have lots of vomiting, they might even lose weight. It is very common for women to lose at least a couple of kilograms of weight in the first 3 months of pregnancy because of vomitings. And that is a great cause of concern for many women. But I can reassure that the first few months, the need for weight gain is really remote. And another one is how much is the weight gain in each time of pregnancy. In the first few months, usually, as I said, many women won't gain weight. That's not a problem. The most of the weight gain happens in later on, in the second 3 months and the last 3 months. That is the usual time that women put on weight during pregnancy. When there is not enough weight gain, you don't really have to worry, because the importance of antenatal care, you will be coming to a doctor for a checkup, and at that time we will be checking whether your baby is growing well or not. So it is not a great cause of concern if you are not picking too much weight but the baby is growing adequately and appropriately. That can be measured through clinical examination and scans, and if there is anything, we will usually let them know that this is the ideal healthy diet that you have to follow. First few months you might not gain weight, but the later, in the second 3 months and the last 3 months, is the major weight gain during pregnancy. And we try to restrict if there is a diabetes or anything. If there is too much of weight gain, this is what we'll advise. Try to limit the intake, and choosing healthy options will usually not increasing too much of weight. At the same time, the baby will have the right nutrients to go to. Some women will get concerned if their tummy is not showing up prominently, and they usually compare with other women and say, is my baby not growing well? Why is my tummy not showing? If women have strong abdominal muscles, their tummy might not show very well. But the importance of clinical examination, if the baby is growing fine but the tummy is not showing, is actually okay in few circumstances, but if the baby is growing fine. And if there is a concern, usually the doctors will check and let you know. If it's not a concern, it's usually reassuring.